Mona. My name is Hannah Sabasic. I'll be your student physical therapist today. Today we will be performing the MiniBEST Test, which is indicated for patients who have a vestibular disorder, who may have had a stroke. And this test is really looking for people who have pretty severe impairments or a high number of impairments. So then we break down the test to look at dynamic gait, sensory, and then reactive and anticipatory postural adjustments. And so we would choose this test over something like the FGA. The FGA might be a little bit more high level or more high functioning, so that would be more for individuals who are ambulating in the community and especially require the use of stairs, whereas the MiniBEST test is more for maybe like task-specific impairments. First thing that we're going to do is I'm going to have you cross your arms, and we're going to stand up from the chair without using your arms to stand up. So, okay, good. And then while you're here, you can put your hands on your hips and come up onto your toes and stay there for 1, 2, 3. Good. And back down. So now we're going to test your balance on each leg. So you can shift your weight over a little bit to the left, lift your right leg up, and we would stand here for 20 seconds. And then you can put your leg back down, shift over to the right, and lift your left leg up for 20 seconds. Good, you can relax there. And so next thing we're going to do is have you turn and face towards me. I'm going to put my arms here around your chest, and what I want you to do is just kind of lean in. So it requires a little bit of trust. I'll have you lean into my hands, and I won't tell you when, but I'm going to let go, and I want you to just do what you need to do to maintain your balance, okay? Okay, good. Good. So what you did was perfect. We're looking for one large step, and then what I'm going to do is come next to you here, and we're going to do the same thing. So lean into my hands. Good. And then I'll do the same thing backwards. So lean into my hands. Nice. And then on the left side as well. So lean into me. Good. Nice. Okay, so we did the left and right, and we would take the worst score of the two and calculate that into our MiniBEST score. And once again, you're looking for the patient to be normal is to take one large step, and an adjustment step is okay. And then from there, that would be rated a 2. A 1 would be if they need to take multiple steps, and then a 0 would be if they were unable to take a step at all or if they fall. We're moving on to our sensory component, so we're going to be testing your balance here. So the first part, you can keep your eyes open. We're on a firm surface, feet are together. Yep, and we would stand here for 30 seconds. And then the next item, I want you to stand up onto this foam. Good, and eyes are going to be closed this time. So you would stay here for 30 seconds as well. Good, and then you can step off. And now what I want you to do is place about half of your foot, so your toes up onto this incline. Good, and then close your eyes here. And I'm looking for you to be able to maintain an upright posture and position for 30 seconds once again. And good, you can step off. We're gonna walk, and when I tell you fast, I want you to walk as fast as you can. And when I tell you to slow down, I want you to walk as slow as you can, okay? And go. Fast. Slow. Good. And so we're going to walk back this way. Every few steps that you take, I'm going to tell you to either look left or look right. So I want you to just turn your head while you keep walking. And go. Left, right, left, right. Good. Stop. Okay, so now I'm going to stand in front of you. We're going to walk together. I want you to walk, and when I tell you to stop and turn, I just want you to stop and turn as quickly and as safely as you can. Okay. And go. Stop and turn. Good. So for that one, walking backwards with the patient so that I can be right behind them when they turn in case they have any difficulties there. Okay, so now we're gonna start right around here, and do you see that box in front of you?
Yes.
So what I want you to do is step over the box, not onto it, and then just continue walking after that until we reach the end.
Okay.
Okay, and go. Good. For the final component of the test, what I'm going to have you do is stand up from the chair, and then at your normal walking pace, I want you to walk to that second piece of tape over there, and then turn around and come back and sit down in the chair.
Okay.
So yeah, normal walking pace, and make sure that you sit back down when you come back.
Okay.
Ready, and go. Good. So the patient took 8 seconds to complete that task. So that will be important in a moment here. So now what I want you to do is starting at the number 94, I want you to count backwards by 3 while we do that same task.
Okay.
Okay? So when I say go, you'll stand up, start walking, counting backwards, and same thing, you walk to the tape and come back and have a seat. Okay? And go.
94, 91, 89, 86, 83, 80.
Good job. Okay, so our patient took just a little over 8 seconds that time. So you're looking for the patient to be accurately counting, and the number, like amount of numbers that they get while counting, and then also you're looking for a 10% or an increase in 10% when they complete the dual task while walking indicates that a dual task impairs their walking ability, which